So this is the normal peripheral blood smear portion of our one of our lectures, and accompanying video. But just be aware, the adult and pediatric, your lab normal reference ranges, and we'll go over some of the morphologies which you need to know. And then ancillary workup to rule out neoplasia. So this again, laboratory values and normal ranges in adult men and women. Normal blood smear with the feathered edge. So we always like to review cells in the monolayer and not at the very edge of the smear. Learn and know normal morphology. So you have mature neutrophil, lymphocytes, band, monocytes with more foldings, nucleoli and granules, basophil with more clumpy metachromatic granules, and eosinophils with more pinkish reddish granules, and then a platelet, and then blood cells with nice central pallor. Here's some stippling, a platelet, maybe a myeloid cell, and neutrophil. Know the various causes for blood loss and increased red blood cell and decreased red blood cell production and increased destruction, and the various processes involved with the red cell destruction, affecting the enzymes, proteins, trauma, various processes, increased red blood cell production, decreased blood cell production. So now these processes, also if you Google, there are nice tables and with the various red blood cell morphologies, the cartoon image, and all the various associations. So make flashcards and know that code. So here's a case where you have very much more increased central pallor. So you see that that's microcytic anemia, or what you can see in iron deficiency anemia. So we have much more central pallor of the red cells. Here's more target cells, teardrops, some fragments, some of the various associations. Again, the different associations with hypochromic red cell morphology. This is from our colleagues, Dr. Crane, in Chapter 3 in our Atlas of Diagnostic Hematology book. Rouleau for plasma cell myeloma. Basophilic stippling, such as lead poisoning that you can see, or spherocytes. Sorry, these are spherocytes. This is basophilic stippling. Sickle cell, and the various the genetic aberrations, the chromosomes, different types. Here again, sickling, the red blood cells. Elliptocytes are pencil, elongated shaped cells, red blood cells, know its associations, and fragments are called schistocytes. Here again, teardrop sign or pear-shaped forms. This is a blast, but this you could see in myelofibrosis. This was a patient with myelofibrosis with all these teardrops, pear-shaped forms with increased blast, concern for progression. So this is the biopsy showing very atypical megakaryocytes, hyperchromatic forms, 3+ reticular fibrosis, focal collagenous fibrosis, and trichrome, and the prior images showing concern with blasts in the blood. smeared. This is how jolly bodies, or these little DNA inclusions in a nucleated red blood cell. So again, different inclusions in red blood cells and the various associations that you need to know. And scoring is recommended by the International Hematology Lab. They came out with a consensus paper, and the various, the recommended nomenclature in contrast to the various other names used. So for example, teardrop cell, formerly called dacrocyte or pear-shaped cell. The schistocytes can be called Burr cell, helmet cell, horn cell. There's a lot of different cool names. So I guess just know what the recommended nomenclature as indicated by the consensus hematology group. And a plug for our Atlas, where some of our chapters came from, and my references. Thank you very much for your attention.